What we're going to look at now is the Os Coxae. What I have here are two Os Coxae attaching to the sacrum. This is not an anatomical position. If I were to tilt this like forward like this, like a basket, like pretend we're playing basketball, where I have my pubic tubercle and my anterior superior iliac spine in the same plane, now I'm in anatomical position. Just keep that in mind. If you don't believe me, go look at Bob the Skeleton and you will see that this is correct anatomical position. Having said that, now what I'm going to do is use just one Os Coxae, and I'm hoping that you will be able to see that this bone that I have in my left hand is this half of the hip. So let's look at the Os Coxae. Os Coxae means hip bone. It's Latin for hip bone. It's actually made of three different bones. We have on top the ilium, posteriorly we have the ischium, and anteriorly we have the pubis. These three bones fuse together in adulthood to form the Os Coxae bone. Let's look at some landmarks first of the ilium. We know that this is the anterior because that's the pubic region. So this is going to be lateral here. This is also going to be anterior, and this is posterior. This is superior and inferior. We see these little bumps, and they are named for their position. This is the anterior superior iliac spine. This is the anterior inferior iliac spine. We turn this around on the back side, we see the posterior superior iliac spine and the posterior inferior iliac spine. So back on the front, the reason you have these two bumps is because they are attachment points. The anterior superior iliac spine is the origination of sartorius muscle, and the anterior inferior iliac spine is the origination of rectus femoris. We also have a very large flat area here. This is our iliac fossa, and that is the origination of iliacus. Over here, the bumpy surface that looks like an ear sticking out of the face is your auricular surface. This is going to articulate with the auricular surface of the sacrum. We turn this around back. We also see this really large notch here. This notch is called the greater sciatic notch. The greater sciatic notch becomes a foramen once we have a ligament attached to it, the sacrospinous ligament. I'll show that in another video. But for now, it is called the greater sciatic notch because it is opened. Down here on the ischium, we have a couple of key features. This very large bump here is the ischial tuberosity, and the small notch here is our lesser sciatic notch. The ischial tuberosity is the common origin of most of our hamstring muscles. I'm going to turn it around. We have a very large foramen here called the obturator foramen. On the front in the pubis, we have our pubic tubercle. Looking closely, I'd like to point out this structure on the lateral side. This is the acetabulum. The acetabulum gets contributions from the ilium, ischium, and pubis, all three. This is a very deep socket. This is where the head of the femur will articulate.